Hi, Trent London.
Hi, Greg. How are you?
I'm doing good.
Good. So I have a client and a relative.
Okay.
So my client has, when your like your eyelid muscles get tired, you haven't got enough sleep and they twitch.
Yeah.
Okay. So he has that under the eye, right above the cheekbone, under the eye. Sometimes his nose, and then further down, like right above the cheekbone. And
Well, that's a good part of the face. Wow.
Yeah.
Okay. Does he have them in any other parts of his body?
on his stomach,
Yeah.
but those are the areas that he points to the most. He's nonverbal. So the last session, we were actually on a virtual session, and his mom brought the camera in, and I could see that lower space under the lid literally jumping.
Yeah. So, like when we talk, like about spasm, there's like spasms and there's contractures and there's like trigger points, and there's all these variations. There's one thing that I don't usually call it by name, but it's like this little fluttering that you're talking about, and the term is called fibrillations. And a lot of times we think about it associated with the heart, but they can happen anywhere, and it's just like chaotic nerve activity that's usually a byproduct of inflammation. And that blend, that what's it called? It's not nerve, it's nerve soothe. It's actually for fibrillations. Like that's what it's for.
Okay.
And so it's one of the things, because like my body's had like many injuries, broken back and blown out shoulder and all this. And so, inflammation is something I'm always kind of managing because of these old injuries. And as I got older, inflammation's real bad. And when I put that on for like a night or two, well, weeks, and the time I put it on was probably 6 weeks ago. And I still get fibrillations a little bit, but they're like 20% of what they were. Like I used to just have them going all the time in my body. And they're not painful, but they are kind of a little bit distracting.
Yeah.
They're just, and it just means that there is a little something out of balance, but it's just the nerves start firing in a weird chaotic way because of the inflammation, and inflammation that's been there for a while. So I would do the nerve soothe, like as a body tonic. And then I would just do some sort of like anti-inflammatory. It could be black cumin, it could be ginger, it could be frankincense or myrrh, which is 3 wise men, in any version of that. And does he have like injuries or anything like that, or like?
Yeah, he's a pretty special kid. He has a enlarged heart, which is actually getting smaller due to the surgeries and medication that he takes.
Oh, good.
And he has a feeding tube in his in his intestinal tract, because he can eat not necessarily pureed, but like yogurt. He can eat creamed things, but his swallowing mechanism doesn't work well. So like water, I guess fluids that would choke him and everything. He has
How old is he?
15.
And what happened? Like, what was he born with, or was there
It's a genetic disorder. I don't remember the name of it though.
Well, so with that, it makes me like the nerve soothe even more, because one of the things with fibrillations is sometimes there can be like tension in the neck and inflammations in the mouth, and this blend actually is for addressing those. The swallowing mechanism, there's that blend aerophagy that we had in one of the lymphatic classes. But even if you use a little bit of anise, like internally, like a drop or two, and have them drink it daily, it would actually probably improve. I mean, possibly, here you're dealing with a genetic condition, but anytime the swallowing mechanism or like gulping or anything like that, it's part of it's not really like, I wouldn't say dysfunction, but it's like there's something off in the autonomic nervous system. And so that's why the thing with the gulping of air or the aerophagy, it's to like calm that down. It relaxes this area, but it also balances out the part of the nervous system. And like whenever you see like a swallowing issue, whether he communicates it or not, he might not be aware of it because it's probably been there a while, but there's usually an incredible amount of tension or like spasm type activity in the stomach itself, like not the whole digestive tract, just like the stomach. And so it will actually help calm that down as well.
Adding the couple of drops of anise.
Yeah.
Okay. And
like the first time or two, he'll find relief, but like done over a period of time, like if you do this kind of combination like this, like the symptoms will kind of float away, and it's just will like stop being a thing that they point out. The curveball that you have here is that it is a genetic condition, and sometimes, even with other things, people don't always respond the same way. But like this combination, I'd say track record wise has like 80 to 90%, like, man, it knocks it out of the park. The genetic thing is a big curveball because you don't know how ingrained or how much tension is in the nervous system or what the disruption is in the nervous system. So it might take more treatment, or it might need to be augmented further. But that is a great place to start. And I find it to be very, very soothing, very calming, improves sleep. It feels nice. And you don't have to have them swing big with a big bottle. Just start them with a little small bottle. Make sure it brings him comfort.
Okay.
And if it works, then you can just go through and do the bigger size.
And what's in the Nerve Soothe?
The Nerve Soothe is the primary thing is Melissa, but let me tell you the other things in there. Recipes and progress. Melissa, frankincense Oman, ylang ylang, and then hemlock spruce.
Okay.
Yeah, and that hemlock spruce is very specific. Like when I was trying the other spruces didn't do it. Oh. But the main ingredient is the Melissa, but the hemlock spruce is fortifying to the nerves and helps calm those things down. Ylang ylang, it slows down the breath. It's good for calming down some of the nerves, especially when like pain and agitation is present. And then the Melissa is the big nervine in this particular blend. So yeah.
Okay, thank you.
You're so welcome.